Hello, and welcome to Pharmative Live. And we're coming to you live from our digital recording studios right here in Palm Springs, California. And this is our opportunity to have an interactive healthcare forum, providing you healthcare news and insights, and allowing you the opportunity to ask us questions. Please feel free to text us or send your questions to info@pharmative.com. I'm really happy to be able to be here today with all of you. We always say, eat some pancakes, say a prayer, and then love Pharmative Live on Sunday mornings at 10:55 a.m. Pacific Coast Time. Today, before I begin, I just want to talk about our website, pharmative.com, which is the first social media website which is dedicated to healthcare. It's free of charge. And if you go to our website and decide to join, there's information about what Pharmative is. Again, we try to provide practical information, knowledge on making informed decisions with your healthcare professionals to improve your healthcare of yourself and your loved ones. If you decide to join, the only thing that you need is a valid email, establish a username, a password, and then confirm that email, and you're good to go. You go to the main menu in the upper right-hand corner and select Find and Join Channel Networks. And you'll see over 15 channel networks specific to different topics, such as cancer care and research, men's health, women's health. There's a specific channel on technology and healthcare, and a number of others. You join the networks of your interest, they'll populate your trending feed, you can comment, and one unique feature to Pharmative.com is we have a HIPAA-compliant messenger. So from point to point, from friend to friend, from friend to loved one, you can communicate and know that your messages are private and everything is kept confidential. We don't accept credit card numbers because we don't charge for our services. Pharmative and PNN Media basically uses advertising dollars to support the programming that we provide to you at no cost. So that's pharmative.com. Check it out today. Secondly, before we begin, I received a question from a friend of mine named John, and he asked a very interesting question, and this is something that's being circulated on social media. It's also being circulated in the lay press, and his question was, does ibuprofen, common brand names are Motrin or Advil, can that make COVID-19 worse? And the answer to the question is no. And in fact, just yesterday, the FDA issued guidance on that and issued basically to all healthcare professionals. There is no scientific evidence that ibuprofen can make the COVID-19 worse if you were infected with the virus. Now, where this comes from was earlier this month from the Lancet Medical Journal, there was a article or letter that basically said there was a theoretical concern because NSAIDs, so it's not just specific to ibuprofen, but also other drugs like aspirin and naproxen that all fall under the umbrella of NSAIDs, non-steroidal anti-inflammatory drugs. There was a theoretical reason that NSAIDs may increase the amount of a certain kind of receptor called ACE2 receptors, angiotensin converting enzyme 2 receptors, and that viruses use that receptor to infect your tissues. Again, it's a theoretical concern. There's no established scientific and clinical evidence to support this. Now, as you know, we use NSAIDs to decrease pain, fever, and inflammation. So if you're taking an NSAID for a condition such as arthritis or back pain, that's going to blunt your fever, that's going to decrease inflammation, and it may be harder to clinically detect any infection. Okay, so when you're using those kinds of medications, you need to know that, and you need to inform your healthcare team that you're taking, ibuprofen for my arthritis every single day. So again, that's something to take note of. It's not specific for COVID-19. And remember, Tylenol does not have the same mechanism as an NSAID. So Another alternative to decreasing pain and fever would be Tylenol, which would not have that theoretical risk. So again, John, the answer is no. Ibuprofen does not make COVID-19 worse. And I know that the FDA is conducting surveillance over this matter, and I will keep you all informed if that should change. So hopefully I answered that question for you. And again, you can send your questions to info@pharmative.com. So today we're going to be talking about telehealth. And I thought that this would be a really good topic, especially considering the fact of increasing technology which is less expensive, and being able to reach out to your healthcare professionals through your phone, through FaceTime, through Skype, through Google Video, and conducting basically a telemedicine visit through the technology that you have in your existing homes. Just this month, CMS, which oversees a great number of people out there over the age of 65 providing Medicare for their healthcare needs, have relaxed their regulations on telehealth and telemedicine. In the past, it's only been used in rural areas with specified video requirements associated with it. And because of the outbreak of COVID-19 today, CMS has relaxed those regulations. So they have said they will reimburse clinicians for telehealth, telemedicine visits, and those visits could occur on your iPad, your phone, on your laptop, and they can occur through other platforms such as Facebook Messenger even, FaceTime, Google Video, and Skype. And again, there are many advantages to having a telehealth visit or a telemedicine visit. And we're going to talk about some of those, and we're going to talk about later on some of the devices that are available to you to improve your health care. Now, the major disadvantage to have telehealth visits would be the lack of privacy. And so that's something to consider depending upon what is your ailment at the time. But the big advantage would be you wouldn't be waiting in a patient waiting room where there are other sick individuals. You'd be at home and you'd be talking like I'm talking to you right now. And you would schedule an appointment through a provider, through a healthcare team, physician, nurses, that allow for telehealth visits. You would schedule an appointment like you would schedule an appointment for a physical visit. And then you would determine the platform of your conference call, whether that be through FaceTime or Facebook even, Google Video and Skype, what they would allow, what they wouldn't allow, what their requirements, what their comfort levels are. And you would have a visit very much like we're having a visit right now. And there would be a review of your symptoms, and there would be questions about your history and so forth. And then there may be a diagnosis or assessment. And then if medications were needed, they'd be electronically sent to the pharmacy. And then the pharmacy could provide you additional information and questions regarding your telehealth visit. So it all sort of works. It does decrease healthcare costs on average for everyone. It's convenient to the patient. And it decreases your amount of travel time and increases your access. So there are many providers out there, some of which I'm going to list for you, some of which I'm not that familiar with. But if you don't qualify for Medicare, right, then you want to maybe perhaps when you're shopping around for a doctor, ask them. You may already have your family practice doctor. Ask them if they do telehealth visits. Or if they would consider doing a telehealth visit because it's difficult for you to get into the doctor's office for many different reasons. There are other service providers like Doxy.me, eVisit, Simple Visit, Spruce Health, Mayo Clinic. And if you went on to our online magazine, PrideNation.com, there's an article there that discusses telehealth medicine, telehealth visits, and gives you more information about various providers that provide that. Sometimes there is a monthly subscription fee that can range anywhere from $50 to $150 a month. So you want to definitely look at those kinds of fees that they might be charging. Usually the contract is on month-to-month basis, so you can stop the contract anytime you'd like to. But it may be an option for those people, like I said, that have difficulties getting to see the doctor, getting a visit because the patient list is so long and so forth. Overall, I'm a big proponent of technology in healthcare. Hi, Doreen, I see you out there. Hi, John Kirk, I see you watching. Hi, Jimmy. I'm a big proponent of technology being utilized to decrease healthcare costs and to improve access for patients to be able to get to see a doctor to hopefully improve patient healthcare outcomes. So check that out. It may be something right for you. Some people that are not that tech savvy, that might not be in the best interest for yourself. But as we get better and better at testing and better with our technology, these things should be routine. And I think this outbreak of the COVID-19 virus is starting to push us more and more to alternative ways of providing medicine and improving patient care outcomes. So the next part of today's Pharmative Live episode is we're going to talk about a few devices out there that you may or may not know about that you can easily get online that can help you monitor your health and help hopefully improve your outcomes with your healthcare team. So the oldest example of this would be for a diabetic who needs to monitor their glucose levels. There are many devices out there for monitoring glucose levels because we know that high glucose levels are associated with diabetic complications like poor circulation, decrease in vision, cardiovascular disease, and so forth. And these glucose monitors have been around for a long time, but they've been greatly improved. So in the past, it used to be pinpricks, and then you place your blood on a strip, and then you put the strip into the device, and it tells you what your glucose level is, and then you would adjust your insulin based upon your glucose level, and that would allow for individual titration. Now it's so advanced that you can place a patch and then just touch the device to the patch and it'll provide you the glucose level. So that's a good example that's been around for decades. It's greatly been improved, very important for both for type 1 diabetics. The next device that I think you may or may not be familiar with and may not know you can buy this over the counter is a pulse oximeter. And some of you out there are probably saying, what's a pulse oximeter? Basically, it monitors very accurately how much oxygen is in your blood. So you may remember from a visit a plastic clip being placed on one of your fingers or being in a hospital where the plastic clip might be taped. And that's a pulse oximeter. I can't explain to you all the technical aspects of how it does this, but it's through light measuring how much oxygen is in the blood. And generally a normal reading would be 90 millimeters of mercury or higher, or 95 millimeters of mercury or higher. And for anywhere between $13 to $50, you can buy one of these online. And why would I want that? Well, you may have pulmonary function problems. You may have severe pulmonary conditions like COPD, emphysema. And with COVID-19, we know one of the hallmark signs is shortness of breath. Well, a pulse oximeter is a very sensitive indicator of your oxygen level. So if you know your baseline oxygen levels, mine was 95 when I took mine, and my neighbor was also 95, and you knew what your baseline was, that if for some reason you didn't feel well and you noticed that that pulse oximeter, that measure of oxygen in your blood was dramatically decreasing, that would maybe indicate to you, I need to call my doctor. I'm starting to experiencing shortness of breath. And that would be an indicator that you need to seek medical help and perhaps go to the emergency room. So it's a useful device. And again, with all of these devices, it's about using them appropriately. It's about understanding the information they're giving you, taking multiple measurements, understanding what your baseline is, and then contacting your healthcare teams, your doctors and nurses and pharmacists out there to help you interpret the information. Because sometimes it may be a false positive, it may be a false negative, the information doesn't make quite sense to you, and that's when you would reach out to someone to help you interpret the information as possible. Most of these devices are very easy to use, and as you get comfortable using them, then you can use it like biofeedback to monitor your well-being, and use them as an indicator to seeking, medical advice and medical help. So that's a pulse oximeter. Another device, and you may have seen a commercial about this on TV, is for telemetry at home. It's a company called Cardia Mobile. And for $89, you can get a very small device that you can travel with that will measure your electrocardiogram, so the rhythm of your heart, just by using 2 fingers, sends a signal to your smartphone. You can then email that telemetry report to your cardiologist or to your family practice physician, and they can look at that and help you make decisions with regards to your heart rhythm. It's very good at detecting whether you have atrial fibrillation, whether you have a slow heart rate, bradycardia, or a high, fast heart rate, tachycardia, and so forth. So again, that's something that wouldn't be used for everyone, but it's something that if you have a cardiac ailment and you're concerned about normal sinus rhythm, you can talk to your cardiologist or talk to your doctor, whether that be something helpful or useful for you to have at home. Again, it's $89. I wouldn't get one because I don't have a heart arrhythmia problem, a dysarrhythmia, but many people out there do suffer from atrial fibrillation and other cardiac problems where they may find this to be a useful device to have. And again, what's nice about it is it synchronizes to your phone, and then you send an email report to your doctor. And it's easy to travel with. Another device would be an at-home blood pressure cuff. Many of these are very easy to use now. They have, basically, you place them on your arm, you press a button, it syncs to your smartphone, and it gives you a reading within 1 to 2 minutes of your blood pressure, which we know is important to monitor for those patients that are hypertensive and are on blood pressure medication, to monitor it, because we know keeping our blood pressure in a normal range, whether that's through diet and exercise or through adding an additional medication or two, will reduce the likelihood of you having cardiovascular events like stroke and heart attacks. So blood pressure cuffs. And then something I talked about last year on Pharmative Live was you can do an at-home cholesterol lab test, which is FDA certified, for about $60. And one would wonder, okay, why don't I just do this in my doctor's? Well, the costs, healthcare costs are astronomical, as we all know. It's not just the medications, but it's the healthcare delivery system. And oftentimes the cost is tripled or quadrupled. And a cholesterol lab test, maybe $150 through a certified lab. It also is the inconvenience of getting to that lab and getting that physician to order the lab test appropriately, which in my case last year was not ordered correctly. So I went online for $60. You get this kit, you take a pen prick, 4 drops of blood, you put it in a container, and you ship it out, and within 2 to 4 weeks you get a full lipid panel including triglycerides, HDL, LDL. And then you can take those results to your physicians, and they're FDA certified, so they're accurate. And if there was a question of whether they're accurate or not, obviously you would repeat the test, but they're accurate. And then you can even go online to a cardiovascular risk calculator, which we talked about last year as well, and you can put in all that information into a calculator. I think it's 4 or 5 variables, and it'll give you an estimation of your cardiovascular risk. You can do all of this online. Telehealth is definitely on the horizon. Utilizing technology can improve your health outcomes. We have our smartwatches now, we have our smart scales, and I would just caution you to only select the devices that you think are going to help you and not to burden yourself with too much information. Do I really need to know the daily BSA I have when it's not going to really change that much from day to day, but rather just know how much I weigh on a weekly basis? So utilizing that information on your specific needs for your family needs can improve patient outcomes. And with the technology that we do have today in 2020, there's no reason for us not to utilize it and to consider telehealth and telemedicine, whether it's right for you or not. So that's all I have for today on Pharmative Live. Hopefully we'll see you next week as well. I've been told that Oprah is now live with Alicia Keys. So Oprah has her own Facebook Live show too, and now we precede her. So after you hang up from me, check out Oprah's website too. She doesn't need commercials. Pharmative.com needs commercials. And one of the very best things you can do also is download our PNN Plus Health mobile app, which not only has a great music station for workouts and dancing, but also has TV programming, cartoon programming, films, but a number of healthcare tools from the NCI, the National Institutes of Health, the FDA, all in one app called PNN Plus Health Mobile App. So check that out today too. I'll see you next week. And in the meantime, stay healthy because it's easier to prevent disease than to treat disease. I'll see you next week.